Hi, I'm Dr. Dean Peppard, and I'd like to thank you for taking a moment to watch this video. In this video, we're going to talk a little bit about posture and how it influences our health. I've got my spine here as a model to demonstrate some of the more common misalignments that people come in with. As you can imagine, we have a lot of people come in for different reasons. Sometimes they've been involved in an auto accident, sometimes a sports injury, sometimes they just have a postural issue. And by and large, that is what drives most people in, is a postural issue. So we're going to talk a little bit more about the most common misalignments that I have patients come into the office for. So first of all, I want you to see what a normal aligned spine should look like. We normally have, and this would be a side view of the spine, a backwards curve in the low back called lordosis. We have a kyphosis in the middle back, and then in the neck we have another lordosis. The most common issues that we see is a loss of the lordosis either in the low back or in the neck. So I'm going to demonstrate what that would actually look like on my model here. Normally, we would expect to see a curve that bends slightly backwards in the low back. But typically what happens when patients come in with a back problem is that spine has actually flattened out, and that causes a lot of irritation on the nerve roots. It's kind of counterintuitive actually, because we might expect that stretching the spine forward would open up space for the nerves to provide a good impulse. But that actually creates spinal nerve stress, and it leads to a lot of pain that people have. Often it will lead to other symptoms as well, such as tingling or numbness or burning sensation. Similarly, the same thing can happen in the neck. Normally, we have a nice backwards curve in our neck. But what happens as we're doing things all day long, that curve starts flattening out, right? What are people doing all day now? They're texting, they're typing at their computer, and they're bending forward reading, and they're writing, and all day long what's happening? That neck is going forward. And that's what creates a lot of problems with the spine. So, what do we do about these misalignments? The idea is, if the spine is going out of alignment forward, such as in the neck or the low back, what are we going to do? To reconnect the brain to the body, we're going to have to get that curve backwards in the low back and backwards in the neck. And that's what the chiropractic adjustments do. A lot of people know that when you have your spine out of alignment, you go to the chiropractor and you get it realigned. And that kind of begs the question, what's the most common misalignment? Well, now you know. Those are the most common misalignments. It's that forward bent position in low back and the forward one in the neck. I should say too that we do have other patients come in and they do have other misalignments. For example, in the low back, there might be a scoliosis or a deviation, and certainly those misalignments are common and we do see those. But by and large, I just like everybody to know that the low back and the neck, when they go forward, that's really the primary misalignment that we see in most patients. There are many things that you can do on your own to help yourself, but oftentimes if you're having pain, maybe numbness, tingling, burning sensation going down into the arms, usually it's too late for exercise alone to fix that, and that's where a chiropractic adjustment can help. So when patients come in and they're having those symptoms, really the adjustment's one of the best ways that we can fix those people. Well, that's it for this video. I'd like to thank you for taking a moment to watch this, and hopefully you learned something about posture and how the poor posture actually influences our spine and creates issues with it. And if you are having any issues that are potentially related to your posture, we welcome the opportunity to have you come in so we can take a look at you and do a consultation with you. We'll see you next time.